So these are the equipments what we need to do the NG feeding procedure. Normally we need a measured feed. Normally we can go with 150 to 300 milliliters per feed. Then we need glass of water, kidney tray, and we need a spoon. This is the normal food serving tray. Apart from that, to do the feed, we need 3 types of syringes. We need 50cc one, 20cc one, and 5cc syringe. Normally, 20 to 5cc syringe we use to check the patient's NG placement. Based on the method what we are using to check the patient's placement, usage of this syringe can be varied. Okay, then we need stethoscope, measuring glass or measuring cup, scissor and plasters. Then we need a bib. If you don't have a bib, you can use normal clean towel. We should put it over the patient's neck area to prevent soil by our foot. Okay, then first of all, what we have to do is we want to go and talk with the patient. So first of all, we'll go there and we will identify the patient first. This is our normal patient area. It's depend on nursing care home or a house, whatever the patient area. Before approaching the patient, first of all, we should rate the BH. Normally, we have to check the name, age, condition of the patient. Sometimes your patient may be conscious, unconscious or semi-conscious. Everything we should check, and the time of last meal, amount of last meal, everything we should check. Once we check the patient's basic details, then we have to go and talk with the patient. First of all, we should grade the patient according to the time of the day. So it may be the morning time, evening or afternoon. Based on the time, we should grade the patient. Then we should introduce ourselves. Sometimes this is maybe the very first time with this patient. So main thing is we should introduce ourselves. Hello, Mr. Smith. Good morning. I am your caregiver today. I am Kaushalya. So how are you feeling today? Likewise, you should enter the normal conversation with the patient. Then we have to check whether patient had his meal or a patient has any discomfort like need of urination or whatever, we should check. Then we have to explain the procedure. Today I am going to do a NG feed. Do you have any restrictions or do you have any preferable food items? Now I am going to offer for you a glass of juice. So do you have any preferable fruit for your juice? Likewise, we should ask. After that only we should make a juice. Then, okay, now patient is all okay and we explain our procedure well, and we should tell the patient, now I am going to get the necessary equipment. So please stay for a while. Then we have to rearrange the area. Sometimes patient's bedside may be any other equipment, but here there are no any equipment, but sometimes there may be thermometers, any other documents, whatever. We should make proper arrangement, because once we took the things here, we cannot move everywhere here and there. We have to put it and we have to start the procedure. Okay, so I arranged the patient's area. Now I am going to take the necessary equipment. Okay, once we take all the equipments to the patient's side, next step should be we should position the patient. This is the normal regular line position. Within this position, we cannot do the NG feeding, because if we feed the patient in this position, there is a risk for aspiration. So we have to change patient's position from supine to semi-fowler, fowler or sitting. Based on the patient condition, any kind of position, the patient is restless and unconscious. First of all, we have to put side trails. Otherwise, When we are moving the bed, patient can be fallen down from the bed. Okay. Now, this is an adjustable bed. So, you don't need to do anything. You can adjust bed. Okay. This is normal semi-fowler position. Sometimes you have to work with non-adjustable beds. Then you can use extra pillow to pop up the patient. Now patient's position is okay. Next step should be we should wear a gloves. Okay. Before start the feeding, our first step should be position the patient. Next one is we should check the patient's NG placement. As I told you, there are mainly 3 types of methods. First one is ball standing, one is X-ray method, but in the home setup, it is not practical for us. So, our next preferable method is pH or a litmus method. Otherwise, we can do the stethoscope method also. For today, we will do stethoscope method. First, what we have to do is, we have to get 20 cc syringe and we have to draw 20 milliliters of air to this syringe. Then, we have to keep the stethoscope normally 3 fingers below to the sternum. Here, please keep in your mind, if you are unclamping the patient's NG tube, you should manually clamp it by your hand until you connect syringe to the NG tube. Now, it's already sealed, so we don't need this one. Okay. Keep stethoscope 4 fingers below to the sternum and same time at once you should flush 20 cc air to the patient's stomach. When you are flushing 20 cc air, you can hear the hush sound from patient's stomach. If you cannot hear that sound, it means the NG is not in the correct place. So, then you have to go with another method to check the patient's NG placement. Sometimes due to abdominal sounds and additional cracking sounds, you can confuse with this sound. So if you are confusing, if you have any doubt with this sound, please don't feed. You should wait and you have to go with another placement checking method. You have to confirm placement in a proper manner, otherwise it can cause negative consequences to the patient. Now patient's placement is okay. Now we are ready to feed the client. As I mentioned earlier, we cannot feed more and more fluid to the patient. Normally we have 150 to 300 range. We make this range dividing 24 hours amount by hours of the day. If we have to give 2400 milliliters per day to the patient, we have to divide that amount within 24 hours and we have to take hourly amount and we have to make 3-hour regular intervals and every 3 hours we have to feed patient normally 150 to 300 milliliters. Okay. Before start the feeding, now we are going to work with the liquids and the things. We should place towel or bib all over the patient's neck and chest area. Normally, we are using 50 cc syringe to feed the client. Then we should remove 20 and we have to set 50 to client. As I mentioned earlier, before feed your drink to the patient, we should first give 30 milliliters of water. Here is water. We should measure it properly. Here is 30 milliliters of water. The other main thing is always use to get the equipments, feed, everything within your left hand. Because otherwise, you can see hand crossing can unnecessarily make some stress on patients NG tube. Keep this in this way. Normally we should keep the patient's NG tube little bit higher than patient's nostrils. Then we should pour. Let it go in according to the gravity. You can see before it's over, you should clamp it by manual way. Then you have to measure. Normally we can give 300 milliliters of feed. Here there is 100. So I can go with up to 300, but up to 300 with the water. All amount should be 300. Now we already feeded 30 milliliters to the patient. So we have only another 270. So after the feed also we have to give another 30. So all together we have to give 60 milliliters of water. Then we can give 240 by our feed. Okay, here is 240 milliliters of feed. Every time this measurement side should be in your. Now you can see before it gets totally finished, we should clamp it manually, and we have to give another 30 milliliters of water. Okay. Now all feed be given to the patient. The another thing is, sometime the small amount you can see there is a residual, so we can pour it to the KBC. Otherwise, when we are disconnecting the tube, it can split out all over the patient's area. Then we can remove it. Now again we have to clamp it. Okay. Now feed is over. Then we have to remove the towel, and we have to ask whether patient has any other need. Otherwise, we should keep the patient in this semi-fowler position another 1 hour, because if we put the patient in the sideline position again, that stomach content can come out and it can get aspirate. Prevent, and it's a discomfortable for the patient also. So prevent these type of negative consequences. We should keep the patient in the same position for around 1 to 2 hours. And we should take all these equipment to the kitchen and we should clean it. Before going to the kitchen, we should remove the gloves, and we can use sanitizers to wash our hands. Then we should do the documentation. The documentation part, you should write. Sometime you have to maintain input, and especially normally for the NG feed patient, we have to maintain input and output chart. The input and output chart, there is a printed version, input and output, I told you previously. You should document date and time, type of fluid, and amount of fluid. In the remarks column, you can write any other comment like patient is will tolerate the feed, sometimes some patient not tolerate the feed, sometimes allergic reaction can occur, any other reaction can occur, patient can refuse the feed, different things can happen. So if there is any specific thing happen, we can put it in the remarks column. Otherwise, we can put the input and output chart, and separately you should maintain your caregiver records and patient's dietary diary. Got it? Okay, now documentation part is over. Next one is, we should tell the patient now procedure is over and you have to wait another 2 hours in the same positions. Okay, Mr. Smith, now your NG feeding procedure is over. I think this position is good for you for another 2 hours. If you have any uncomfortability, please let me know. If you get any itching or breathing difficulties, please let me know as soon as possible. Sometimes allergies reaction can occur like skin irritations, skin itching, or a breathing difficulties. So we should tell the patient if you get any unfamiliar things, please let me know as soon as possible. And we should thank to the patient, and then we should take all the equipments back to the kitchen and we should clean them according to the standard manner.